let's talk about peripheral arterial disease first. That would be what I would describe primarily as plaque formation or atherosclerosis in the lining of the blood vessels. So that's a different process than blood clotting, but their blood clots do relate in some way. So I want to explain that a little bit. But what you have is what used to be a smooth lining of the blood vessel. Like if I took an artery and I ran my finger over it, it would be smooth like an ice skating rink when it's young and healthy. And over time, because of all the mechanical stresses that the artery is subjected to, plus other risk factors like cholesterol level, smoking, high blood pressure, other kinds of things, you can develop irregularities of the lining and this development of this gooey stuff that we call atherosclerosis that forms narrowing of the blood vessel. And that narrowing may be silent for the most part, but eventually over time can cause a reduction in the blood flow. So you can have this problem of PAD without any kind of blood clot whatsoever. Now, on top of that, you can have slow blood flow because of the atherosclerosis, as well as the injury to the lining of the vessel. And for the reasons that I explained earlier, the blood flowing through it may also form clots, which are more of the deposition of this like jello-like blood clot that can take a vessel that was partially occluded and turn it into fully occluded. And we've had situations where a patient comes in with an abrupt reduction in blood flow in their leg, and we call it a so-called cold leg scenario. And that's more of an emergency. That's somebody who, if we don't restore blood flow to the foot within hours, they could potentially have permanent injury to the tissues of the foot, or even lose their foot because of gangrene and other kinds of situations. So when somebody has, quote unquote, their vessels cleaned out, and that oftentimes could be with a stent or with an atherectomy procedure or balloon procedure, we may restore flow. But if it closes off again, that could be because of regrowth of tissue, scar tissue or atherosclerosis, or it could be all of a sudden because of a blood clot. And those are two different kinds of things that the patient might feel the same way depending on the mechanism, but how the doctor treats that could be very different.